Happy New Year, everyone. Welcome to the SA show, the Seun Akinlotan show. My name is Seun Akinlotan, and I am your host for the SA show. Thank you so much for joining us today. It is the very first episode of 2021. We are grateful and we are thankful to have you here. Thank you so much. If you are hearing me, I would really appreciate if you leave me your name and your location in the comment box so I can know where you're all watching from. Is there anyone there? Leave your name in the comment box so we can know where you're watching from. All right, I am going to introduce our guest for today. So we have a special guest, and I'm going to read our bio right now. Our guest for today is Evi Abada, MD, MS, and she is a resident physician in anatomy and clinical pathology at the Wayne State University School of Medicine. It also doubles as the Detroit Medical Center in Michigan. She earned a Master's of Science in International Health Policy and Management from Brandeis University in Massachusetts. And she's also a global health advocate. She is a member of the American Society of Clinical Science Residents Council and was recently named one of ASCP. ASCP is American Society of Clinical Science 40 under 40 honorees for the year 2020. See, there's a blessing in 2020. Dr. Abada also serves on the leadership team of 500 Women Scientists, an organization that is working to transform leadership, diversity, and public engagement in science. You can follow her on Twitter at Evi Abada, MD. So please join me in welcoming our guest for today, Dr. Evi. Hi, how are you?
I'm good. Thank you so much for having me.
And thank you for honoring our invitation. It feels great to have you on board, and Happy New Year.
Happy New Year to you.
Awesome. So we're going to get started, but before we get started, I see that we have people online, and I would love to give everyone a shout out. So please leave us your name and where you're watching from. Leave us your name and your location in the comment box so I can give you a shout out before we start. And also, if you have not shared this video with other people, please do get along right now, share with others so we can have more people join us. So Dr. Evi, am I saying that right?
Yes, you are. It's Evi Abada.
Evi Abada. Okay. Welcome once again. I am always excited when I'm talking to medical doctors You know why?
Why?
Because that's what I wanted to study. When I was in high school, I actually wanted to become a doctor. That's a long story for another day, but we're going to dive right in. So, Dr. Evi, you are a medical doctor and you're also a resident physician, clinical and anatomic pathology at the Wayne State University School of Medicine. What does this mean in layman terms, and why did you choose this pathway? So, what does clinical and anatomic pathology means, please?
All right. Thank you so much. So, thank you for having me. Like I said initially, so I am a physician, and I completed my MD degree from the University of Benin College of Medicine in Nigeria, and I came to the United States, completed my master's, and after doing some research, I went into residency. I'm doing my residency in, like you said, anatomic and clinical pathology. So pathology is maybe for people that do not know, medicine is so broad. Medicine is a very broad specialty, and so it's impossible for a clinician in the current world that we live in to be a specialist in everything. And so in medicine, there is sub-specialization. So when you train as a physician, a lot of clinicians actually go on to pursue specialization in several fields. And so pathology is a field of medicine. Actually, pathology, as is known, is the bedrock and foundation of medicine because it deals with the understanding of diseases, how diseases happen. And specifically for me, why I decided to go into pathology is because I've always been interested in cancer and genetics. Why do cancers happen? Why do people have diseases? And so that's what, in a layman's term, pathology is actually the study of diseases and the understanding of why diseases happen. We want to know, why do people get sick? Why do people get cancers? What are the diseases? What are the genes that are wrong that make people fall sick? And so that's, in a nutshell, that's what pathology is all about. And specifically, I'm interested in women's health pathology, and that includes breast and gynecologic pathology. Okay. And so I'm interested in cancer, studying cancers of the breast and cancers of the female genital tract. So that's where I ultimately will be specializing in it. Yes.
Okay. Yeah. Thank you for that explanation. So, just thinking in my brain, thinking about the word pathology, it just seems to me like the study of the pathway of how something happens. I'm not sure if I'm correct.
You're not far from it, actually. Yes.
All right. So you decided that you wanted to study medicine. Was this a decision that you made out of your own volition, or was it like you had someone that inspired you, maybe your parents or someone that you were really looking forward to, to becoming? So I just wanted to know, because I know that as someone from Nigeria, we tend to grow up in environments where people say, oh, you have to become a doctor, or you have to become a lawyer, or being an engineer. So I just wanted to know, is this something that you were really passionate about, or you had instructions from maybe your family members that, hey, you know what, you have to become a doctor?
So you're not far from the truth, actually, because like you rightly said, I was born and raised in Nigeria. So I did my medical education in Nigeria. So I would credit my parents to actually being the fire that ignited the passion to actually become a physician. So like you probably know, in Nigeria, when a child is growing up, if you are very good with the sciences and you're good in biology, there is this tendency for parents to say you should become a doctor. If you are very good with math, they'll tell you you should become like maybe an accountant or something. And if you're good with your hands and you know how to create things, they'll say go be an engineer. And so right from when I was in the early stages of my high school, I loved biology and I was very good with the sciences. And so my parents were really supportive. They were really like inspirational for me to say, we think medicine will be good for you, even though I loved it per se, but sometimes you need that extra motivation, that guidance. And so my parents were really like, we think you will do well as a physician. And I also had passion for biology. And so having that reinforcement from my parents was just what set me on this path. And I would say I have had no regrets.
No regret.
I tell people that medicine is a calling. Not everyone can become a physician. And so I credit my pathway. I give part of the credit to my parents, but at the same time, it was something that I liked or I loved, but then my parents were just the people that made it go faster.
They were motivators.
Yeah.
And we thank God for great parents, because most of the things that we are today, even if your parent wanted you to do something and then it turned out that you did something else, we still give credit to our parents for guiding us and, just pulling us through those difficult times. So let's move on to your journey to the United States of America. Like you said, you had your bachelor's degree or your first degree in medicine in Nigeria from the University of Benin. Now, as a minority, you found yourself in this environment. How were you able to integrate yourself into the current environment that you found yourself?
Thank you so much for that question. I would actually say I am still integrating. I am not there yet. We're still on a journey. But yes, my story is actually, I wouldn't say it's unique, but I would say my story actually mirrors the experience of many people that leave their comfort zones to go start life afresh somewhere else. And so I left Nigeria to come to the United States to do my master's. I wanted to do a master's in health policy because I worked as a primary care physician in Nigeria before I came to the United States. Okay. And so the inspiration to do a master's actually came from working in underserved communities. And so I wanted to get the training and the experience to impact policies that would make medicine and the practice of medicine easier, especially in low-income settings and underserved populations. And so that was the motivation and inspiration that actually made me come to the United States initially. So I wanted to get an education in health policy and management. But at the same time, I knew that ultimately I was going to practice medicine. Just that I didn't come into the United States at the time that I did. I didn't have all the information that I needed to get to where I needed to be. Okay. And so I would say that my journey there was a lot of learning that I had to do along the way. There were a lot of mistakes that I made, things because out of ignorance, because I didn't know. And so I learned from my mistakes and got back up on my feet, and we are still integrated into the American society. I will tell you, I've been here for a while. I am still learning. There is no, you don't graduate from that experience, because there are some things that you learn every day. And sometimes I ask myself, oh, how come I didn't know that? So I would say that we are still integrated into the system. But there's one thing that I think has helped me settle into this new environment. It's the willingness to learn.
Willingness to learn.
Willingness to learn. You have to be humble enough to want to learn. I think a lot of times the problems that people face is you think you know something, and you assume that character or that attitude of knowing something, and that sort of becomes a barrier to actually learning more and growing. And so I came with the attitude of a learner. I knew I didn't know anything about this environment, and so I wanted to learn. And so I was very open to meeting and learning from people that I had never met before. And I think that was that's what I still practice wherever I go, wherever I find myself. Even though I'm an MD, I learn from the janitors. There are things that the janitors know that I don't know. And so when I have the opportunity to interact with them, I assume the role of a learner.
So you're basically saying that don't look down on anyone and that we can learn from anybody.
Yes, it makes a great deal of difference, because when you tell people that you know, if you put on an attitude of knowing it all, then people that are supposed to help you are going to step back.
Ooh.
So I always come with an attitude to learn. I don't know anything. I tell people I don't know anything. I want to learn. And I go to places empty because I want to come back filled.
Oh,
So
wow.
that's what I do. So that's that. We're, like I said, I'm still integrating into the system, but the way that I've been integrating into this new environment is the ability to want to learn and unlearn and relearn.
Wow, that is great. So you said you go into a room empty so that you can come back home full. I've never heard it that way. And that's something that I'll be taking away from this session today. If you are just joining us, welcome to the SA show. My name is Sean Akinloton, and with us today is Dr. Evi Abada. She is a medical personnel and she works currently at the Wayne State University Medical Center in Detroit, Michigan. Now, Dr. Evi, I'm going to press you a little further. You had mentioned when you were answering the question about integration, you had mentioned that you made so many mistakes along the way. Of course, I made a lot of mistakes as well. One of the mistakes I made was to ever get a student loan. I don't have any business getting a student loan. If I had information, I would have bypassed that step and actually, maybe become a teacher's assistant and have my tuition paid that way. And hearing you say that you made a lot of mistakes along the way, and I don't know, we have people that are watching you right now that, maybe they're already in the US, or maybe they're thinking of coming to the US or even any other country. Can you state specifically like one mistake that you made or a step that you took that if you had prior knowledge in that area, you would have done better?
Thank you so much. So one thing that stands out that actually comes to mind without even thinking about it, was the fact that getting back into medicine was a huge challenge for me. So I would say the mistake that I made was and that mistake stems from the fact that I didn't have the right information at that time. I didn't know that when you're trying to get back into medicine in the US healthcare system, the time that you've been out of medical school to when you want to get into residency, I didn't know that the longer that you've been out of medical school sort of counts against you. I didn't have that prior knowledge. And so when I got to the United States, once I completed my master's degree, rather than, go all in to take the licensing exams in the shortest possible time as at that time, I was like, I am not ready.
Let me take a break.
I'm not ready. I want things to happen at this pace. And so I was taking my time without knowing that taking all that time was going to count against me.
It's actually a red flag.
In future, when I was ready. And that's because I didn't know. I didn't know at that time the impact of taking that gap or allowing that time lapse to happen. I didn't know. And so, sometimes we want to do things and we expect things to be perfect. We expect conditions to be the way we want them to be before we make certain moves.
Okay.
And so that was the mistake that I made. I felt I didn't have all the resources that I needed at that time. I felt I didn't have, I wasn't ready. I felt I needed to work a while post my master's degree before I got back into medicine, into residency, without knowing that when it was time to apply for residency, someone was going to say, why do you have this gap?
Yeah, it's actually a red flag. People want to know, what have you been doing during that time period?
Yes. And so that's what I tell younger medical professionals that are coming to the country and they're looking for guidance, they're looking for advice. What do you want me to do? And I ask them, what do you want to do? What are your plans? Do you want to do medicine? Do you want to go back do you want to practice medicine in the United States? What do you want to do? And if they tell me the ultimate goal is to get back into medicine, I tell them, take your licensing exams as soon as possible. Don't make the mistake that I made, because the longer you're out of medical school, is going to count against you. So that was one specific mistake I would say that I made.
Absolutely. And I think for some of us that might be online right now listening to Dr. Evi, it doesn't really have to be, wanting to become a doctor, because not every one of us will become a doctor. But whatever your future goals are, try as much as possible to gather that information that you need, so that when you are truly, truly ready, you will not have those roadblocks. In essence, I'm saying that procrastination is not your friend. Procrastination would rob you of the things that you're supposed to get. It will also limit you in terms of the heights that you can reach. So procrastination and not doing due diligence can really, really, give us a setback, in case you're listening. Dr. Evi, so you were able to integrate yourself, or let me say you're still integrating yourself, but recently you made news when you were named as one of the American Society for Clinical Pathology 40 under 40 honorees for the year 2020. How did you arrive there, and how does that make you feel?
Thank you so much. I know 2020 was a tough year for many, but personally, 2020 was one of my best years, I would say, professionally, because in 2020 I was blessed and fortunate enough to be awarded with some awards that maybe, I don't know, but I would say maybe because of the experience I had going back into medicine, maybe because of the roadblocks that I was experiencing at the time. When I finally got into residency, I didn't want to take that opportunity for granted. I knew that someone had given me that opportunity. You are attending several interviews, you're telling people your story, but your story doesn't resonate with everyone. And so when my story finally clicked with someone and I was given that opportunity to actually live out my dreams, I didn't want to take it for granted. And so from the first day of my residency, I knew what I wanted to do. And so I knew, I always went to residency with this mindset. You are not there for yourself. You are representing people that are coming after you. I wanted a situation whereby people would say, oh, Evi, oh, she was this good. And because you have a connection to her, I would give you a chance. That was the mindset I went into residency with. And so from the first day of residency, I didn't take my duties lightly. And so the 40 under 40 award by the ASCP is actually given to honor rising leaders in the field of pathology. And so every year, 40 people under the age of 40 are recognized by the ASCP just to highlight what they're doing and to let the world know that watch out for these people. And so it's not an award that is given to everybody. Sure. It's an award that they give it to people that they think deserve to be recognized for what they are doing. And so I think it was humbling, but at the same time, it was gratifying for me because this was somebody that people were saying couldn't do medicine anymore. This was somebody that people were saying, oh, because you've been out of medical school for this long, then you are no longer qualified to be a physician in the United States. And this is the same person that is being recognized for doing excellent work. And so I would say it was humbling, but at the same time, it also let me know that hard work pays. And hard work pays because right from my first year of residency, first of all, I recognized that someone had given me an opportunity. Secondly, I knew that I wasn't there for myself. I knew I wanted to leave a statement so that when people that look like me come after me, someone is going to say, oh, because this person might be a second Evi. So that was the mindset that I went into residency with. And I'm thankful that I'm living up to that grace that was given to me, and I'm hopeful that people that are coming after me would have it easier.
Amen.
It's what people like us are doing.
Yes, it's a lot of work, and I would like to say congratulations to you. I know quite a handful of people that studied medicine from other countries around the world, and when they got here, they actually tried their best. Maybe they took a break just like you, and they weren't able to get into practicing medicine again. So when I see people that have been able to weather the storm, I know you're trying to say it lightly. I know that a lot of effort and a lot of hard work has gone into you being able to integrate yourself back into the medical field. So it's a lot of work. And I actually love when you said that hard work pays. Something as simple as applying, it can be a lot of stress for a lot of people. But I would like to say that take it one step at a time. The first battle that you would have to fight is the battle of the mind. Just battling things in your mind that, yes, I'm in a different society, or even if you are in the same society, that, yes, maybe there are so many stacks that there are so many odds that have been stacked against me. I'm still going to go ahead and do my own part. I think that's where a lot of people fail. People fail to do their own part. They expect the other part to fall in line before they fall in line. But when you are in the pursuit of excellence, when you are in pursuit of your dreams, you have to fall in line first, and every other thing or people around you, when they see the energy that you bring to the table, when they see that you have a great resolve and that you're so passionate about this, you really want this, then things will begin to fall in line for you. And thank you everyone for joining. Oluwakemi Opayemi says, go into a place empty so you can come back full. Yes, and that was a quote by Dr. Evi. She also says, when we don't have the right information, we make mistakes. Absolutely. And that is why it's so important for us to have good people around us and also have the courage to ask. If you don't know something, it's better to ask than going the mile by yourself. Tolulope Shoboye just says, wow. Tony Godoy says, hello, Dr. Evie. I think that's someone that knows you. Ogurombi Elizabeth says, awesome. All right. So we're going to move into the next question. And I think that you already answered a part of it, but I still want you to explain to us how you were able to secure your residency. I think this information is important because this is something that a lot of people are trying to get. They're trying their best, they are taking their exams, they are studying, but somehow they still have not been able to pass this licensing exam, not to talk of, getting a spot in residency. Some people, maybe they have family situations that will prevent them from moving from one state to another. Please share with us your own personal story, how you were able to overcome all the hurdles to get your residency and to integrate yourself into the new environment that you found yourself.
Thank you so much. So yes, it was a lot of work, but just like with any goal that we have in life, I think having a goal, everyone can have a goal. Let me put it this way. Everyone can have a goal, but achieving that goal is where the work is. So for me personally, I knew that I wanted to be a physician. And even when I started applying, I didn't get into residency after my first application. I didn't. I had to apply more than once. But I knew that after each application cycle, I learned lessons from the application that didn't work out. So going back to preparing for the licensing exams, it was a lot of work because, like I said, I took a break. There was a break between when I completed my master's and when I got into residency because I wanted to start a family. I wanted to have a family and I wanted to support my family. And so I understand that that's a challenge that a lot of people have, especially women. It's tough to combine your family responsibilities and pursue your career. But like I said, that was a goal that I had. I knew that I wanted to do it, and I knew that no one was going to do it for me except I did it for myself.
Absolutely.
It was tough. There were days that I used to get maybe 3-4 hours of sleep, but that was the only way that I could do it. Because, for example, you are a new mom. How are you going to, as a new mom, I was studying for those exams. Even while I was pregnant, I had to travel out of my state to go take one of those exams. Thankfully, I have a supportive spouse who bought into my dream, and he knew that this is what I wanted to do. And so he was ready to support me. And so for women that might be in the same situation, I would tell you that one of the things that has gotten me to where I am today is my husband. My husband has been very supportive. I think having that conversation with your significant other to know what your goals are, to know what your dreams are, I think it helps. Because my husband knew that this is what I wanted to do. He couldn't take my exams for me, right? But he knew that I needed some time to study.
Yes.
And so that's where the difference, that's where the different steps, right? So there was that balance in the home, on the home front. And so I was able to do my exams. But I'll tell you, it goes beyond completing the exams. You know why? Because there are so many people, thousands of people all over the globe that are taking those same exams with you, and they are applying for the same spot that you are applying for.
Oh, so what do you do?
So yes, after my first application, when I didn't match into residency, because I'm the kind of person, of course, with my master's training, we were taught to always do a root cause analysis. Why is there a problem? There is always the why.
Yes.
Why is this a problem?
Okay.
And so once I did the first application cycle, and it didn't work out, then I started to ask questions. Why?
Okay.
Thankfully,
and were you able to find the answers?
Yes. Thankfully, when you're going through such certain stages of your life, you hear so many things from different people. I'm the kind of person that I consciously put myself in environments that lift me up rather than being in environments that puts me down. And so even in that very tough situation, even in that very difficult time that I was going through at that time in trying to get back into medicine, there were people that told me, this is done. Don't even waste your money.
Wow.
Don't do it. Just do something else. Go do another master's. Go get a PhD. Go do nursing.
Wow.
It's done. There were people that told me there was no way I could do it. But at the same time, there were people that said, your case is not unique. People with even worse cases have matched into residency. They were able to do it. And so those are the people that I align myself with, right? And so thankfully, I was able to talk with some physicians, some clinicians in the United States, some also residency directors of other programs when I was living in Massachusetts at the time. And so I was able to meet with some faculty that are into residency. And I said, this is my situation. And they're like, okay, bring your application. Let's take a look at your application. And one of them looked at my application and said, there's one thing that I see that is standing in your way. I think the only thing that is standing in your way is the fact that you've been out of medical school for a long time.
Okay.
But we can strengthen other aspects of your application and see if it makes a difference. And so I was advised to do more to get more volunteer experiences. I got that. Over the weekends, I wasn't staying at home. Over the weekends, because I used to work Mondays to Fridays, so my weekends were for volunteer work.
Yes.
Saturday morning.
Is so big, and a lot of people don't understand. I tell people all the time, if you have a resume and there's no volunteer experience on your resume, it's going to count against you. They will never tell you. You will never know why, but it's going to count against you. So when you volunteer, you need to put that on your resume And you need to make sure that when you're volunteering, the person or your boss, wherever you're volunteering, is able to write you references. Or when people call that person can say good things about you. So volunteering is truly important. Continue.
Thank you. So yes, I spent my weekends volunteering, and also I had to get more clinical experience in the United States. So they told me, yes, you're a physician, but then you need to get more clinical experience in the
Mhm.
United States. And so I stopped taking vacation time. My vacation time was spent shadowing clinicians, doing
Mhm.
observerships and externships, just to
Yeah.
get make my application stronger. That's the only thing I could do, because like I tell people, there are some things about our lives that we cannot change.
Hmm.
When you're working on a goal, you have to be cognizant of the fact that there are things about that goal that you cannot change.
Hmm.
But there are some things that you have control over, that
Okay.
you can manipulate a bit, and that could make a difference. So, for
Hmm.
example, I was applying for residency. I had been out from medicine for a while. I took a break, right?
Mhm.
I couldn't change that.
Yes.
I couldn't change the fact that I am an international medical graduate. I couldn't change the fact that my medical school was outside the United States.
Mhm.
I couldn't change my grades.
And you couldn't change your race,
I couldn't change my race.
your gender.
I couldn't change my gender. I couldn't change my scores on the tests.
Yes.
But there were things that I had the power to change.
Change. Hmm.
I had the power to strengthen my application with experiences that I had.
Yes.
So I was working in research. I was volunteering, and I was getting more clinical experiences. And I will tell you, when I finally matched,
Hmm.
after I matched, I compared the application that I used to match
Hmm.
with the applications that I was
That
using before.
rejected from.
There
They
is
are
no,
like,
there is,
what the fuck?
it's like night and day.
Wow.
Yes, it's like, and sometimes I tell my husband, I'll tell my friends, I'm like, really? I can't believe I was applying with this resume.
With this regular, and I'm sure at that time you are taught that you tried your best. You know,
Yes,
when people say, I've tried my best, I've put in all the effort that I could, and because you said something, you said you are always open to learning. So because you were open to learning, you didn't accuse the system. Oh, it's because I'm a woman. That's why I was rejected. And you know what? I'm not doing this again. Oh, it's because of my school. Oh, it's because of this. But what you did was you said you went through root cause analysis. You shifted the blame from external to internal and say, you know what exactly did I not do right? And what can I improve on? And I also love one step that you took. And that step was the fact that you took that application, you took it to the experts, people that have gone through similar pathways, and they were able to analyze because they've gone through that. They were able to spot the things that you didn't quite pay attention to. It's called the blind spot. You know, when you're driving and you're looking at your side mirrors, sometimes there's a spot that a car is actually coming behind you, but you just can't see them from that side mirror. So it's important that as we are going after our goals, each time we reach a roadblock, we need to take a step back to analyze and say, you know what? Where did I go wrong? What can I do better? And also talk to other people that have more experiences. And the fact that you were volunteering, I'm sure the people you were volunteering for, when you asked for help, they will be willing to offer the help to you. So it's really important that when we are on this journey to a particular destination, yes, we're going to, come across roadblocks, but it's important that we go internal first to analyze ourselves and ask the why question, which I really love that you did. I'm going to read some comments now. And Yetunde Adedokun says, thanks for bringing this to the table. Keep it going, man. Watching live from Ibadan, Nigeria. Yes. Shoboye Jotulokwe says, are there volunteers in the house? Yes, we have a lot of volunteers. Oluwatosin Arodide says, very important to stay in an environment that lifts up. Absolutely. I cannot overemphasize that. And Yetunde says, wow, I just learned something new. Volunteering should be included in your resume. Absolutely. Put up volunteer experience in your resume. And Chooks Obiora says, I love volunteering. We're going to go on a short break now. Don't go anywhere. When we come back, we're going to continue this interesting conversation. Welcome back, everyone. If you're just joining us, my name is Seun Akinlotan, and I am the host of the SA Show. With me today is Dr. Evi Abada. She is a clinical pathology at the Wayne State University, Medical State University in Michigan. Now, we're having a conversation, and I have a question for Dr. Evi. Dr. Evi, as you know, because the topic for today is how to succeed despite opposing circumstances. Opposition is a normal part of life. We face opposition in almost everything that we do. Nothing great will land on our laps on a platter of gold. So we have to work hard. You said that already. But I wanted to ask you, in the course of rising through the career ladder, do you have any specific opposing circumstances that you had to go through? I know you already said that you took a break from medicine and it took you a while to come back. But my question now is related to your career. Once you were able to start practicing medicine, did you encounter any opposing circumstances? If yes, could you please share what those circumstances were and how you were able to overcome, or how you are still overcoming those circumstances?
Thank you. In residency right now, I cannot actually remember any experiences that are opposing. I wouldn't say opposing right now in medicine, but before I got into residency, I have experiences from when I was working in the corporate world before I'm getting to residency.
Okay.
I would say, I worked for a boss one time that I would say she was the person that was one of the catalysts for putting me back on this journey.
Can you explain?
Like I said, when I completed my master's, I wanted to work for a while. So I wanted to, you were self-sponsored, so you want to make some money. And so I got into the job market. I got into the labor force. And I got this job. And I was working for this boss that, I don't know, but from the first few weeks that I started working there, she started to give me a very tough time. I would say she was the perfect description of what a mean boss is.
Wow.
But I will tell you, sometimes there are some experiences that we have, and some people take those experiences and they see them as negatives. They see them as challenges, and they feel depressed. They feel that the world is done for them. But I will tell you that working for that lady sort of resets my career button. Because while I was working for her and she was treating me the way she was treating me, she made me realize that, you know what?
You can do more.
It was a research position. I was working as a research coordinator. She was working as the research manager for a physician. So a physician was our boss.
Yes.
And she was my boss.
And you are a physician.
Yes. So when she was treating me the way she was treating me, I was like, wait a minute.
And clicked. Like, you know what?
This lady can actually work for me someday. But the only way she can work for me is if I take this step and become a physician. I become a physician.
Yes.
And one day, I'm going to do my own research. One day, I'm going to need my own research manager.
Absolutely.
And she can work for me. So she was one at the time. It was hell. It was hell working for that woman. I'm a person of faith. So when I was working for her, there were days that I would be going to work, and all through my ride to work, I am just praying. Because I don't know what's going to happen that day. You know, so that was the kind of environment that I was in. But at the same time, that experience was what made me realize that, you are just wasting your time.
It made you realize that you were made for more, that you could actually get out of this situation and make something better out of it.
Yes. And that was where the fire lit for me.
Wow.
And so I started studying for my exams. I started studying for my exams. And, when I got recognized last year by the American Society for Clinical Pathology, one of the persons that I worked with at that place, he called me. He said, wow, I cannot believe that you are the same person. Yes.
Wow.
So that's the experience. So I would encourage everyone that is going through any challenging situation right now. Sometimes we focus too much on the problem without taking a pause to actually understand what that problem is teaching us. The way I look at life is that I tell people that nothing happens by accident. Sometimes things happen that might not be comfortable. Things happen that might not feel right sometimes, but there is always a lesson
to learn.
But your ability to take a pause and just learn the lesson that you're supposed to learn from that situation and move on is what will make the difference. And so, yes, that's my story.
Absolutely. I love that. I love that. So you were in a difficult situation, but instead of, being resentful, instead of blaming everyone else, instead of throwing your hands up in the air and, giving up the towel, you were able to take a pause and look at that situation like, oh, am I in my right senses? I mean, I could actually do better. And you started studying. That's awesome. So Tony Godoy says, peace and blessings to you, Dr. Evi and Sean. Thank you for this awesome show. Tony G from USA. Thank you, Tony G. I am enjoying the session. So says Chucks Obiora. Olayemi Akinloton says, great job, doctor. A bad attitude opened your eyes for you to do more for yourself. Absolutely. Choboyejo Torilope says, I love how you were able to turn the challenge around to your favor. Absolutely. I love that as well. One of the best things, Dr. Evi, one of the things that I consider to be the best things is that as a professional or even as a business personality, one of the best things I believe you can do for yourself is to have mentors and sponsors in the workplace. Now, what tips would you like to share with non-indigent US professionals. So I'm specifically asking you for tips for immigrants because when you started this session, you said something about information. You didn't have information at that time that taking a break, right? Taking a break would affect you when you eventually decide to go for your residency. But now you are a mentor to other people that are willing to learn, right? You're a mentor. So, what tips would you like to share with non-indigent US professionals who do not know about how to go about getting mentors in the workplace? Because it can be very scary to walk up to someone you don't know, especially when that person is not of the same nationality as you. You walk up to them and say, "Oh, would you like to be my mentor? I would love you to be my mentor." So what strategies or tips would you like to share?
So I would say that before you approach someone to be your mentor, you actually have to know what you want to be mentored on. Like you
Okay.
can't just walk onto someone and say, I want you to be my mentor.
Okay.
About what? Like, what am I mentoring you about? Like, so you have to know what exactly you need mentoring on. And
Okay.
so personally, I would tell you, yes, mentorship works. It opens doors. Your mentor might not give you a job, but the advice that you get from that mentor can make a difference. It can help you avoid mistakes. And so, in getting a mentor, I would say, first of all, you have to know what you need help with. You have to know what you want to be mentored on. Number two, everybody that I've ever met to be a mentor, they always want to know, what are your goals? You can't just go to someone and say, be my mentor. They want to know what are your goals for yourself? What do you want to do? Then number three, you have to be seen as working diligently on the goals that you have set for yourself. So for example, I want to be I'm very passionate about women's health, and so I'm very interested in breast and gynecology cancer. And so when I started residency, in my residency program, there are some of my faculty members that are doing research in breast and gynecology pathology. That's what I wanted to do, right? Or that's what I want to do. But then I have to let them know that, oh, she's really passionate about this and she needs help getting into the field. And so right from my first year of residency, I made sure that I was doing the best that I could do. So to look for a mentor, first of all, you have to know what you want. You have to have a plan for getting to where you want to go. Many mentors do not want to spoon feed you. They don't want to tell you do this and do that. They want to just guide you. So you should know where you want to go first and foremost. Then number two, you should know, at least have some information about what you need to get to where you need to be. And then when you go meet a mentor and say, they're going to ask you, so what are your goals? What are your plans? Okay, so how do you want to get there? And when you list out the things that you think that you need to do, then they can now step in and say, oh, no, you can, instead of doing it like this, it might be better to do it differently. So I think a lot of things, because I mentor people, a lot of times I see that people just come to you and say, I want you to be my mentor. Mentor for what? What do you want? What do you need help with? What
Mentor for spoon feeding.
Yeah, so you need to be able to come up with your own. You should have your goal. Don't expect a mentor to design a goal for you. Don't expect your mentor to tell you what to do. No, it doesn't work like that. And again, people value that time. There are people that have there are people that I've mentored in the past that you set up a meeting, they don't show up. They don't show up. First of all, that doesn't look good on you, the person, but at the same time, you're also making a bad impression for people that are coming after you. Then tomorrow, someone is going to say, oh, that's out. No, people, no, I wouldn't do it because that person did the same thing. So that's one thing that guides my activities, what I do. I always think about the people that are coming after me. I know I wouldn't be the last person doing what I'm doing right now. So I need to leave a good impression for those that will be coming after me so that I do not be the stumbling block. I do not become the barrier to someone else's progress or someone else's goals. So the 3 tips I will give you, just to summarize: to look for a mentor. Number 1, have your goals outlined or defined. Number 2, have a plan for how to get to those goals or how to achieve those goals. And number 3, look for someone whose values align with what you're trying to achieve, then go talk to them. People like it when you come up straight up to them and tell them what you want. But at the same time, they want to be sure that you have done your homework.
Yes.
You can't just go to someone without being prepared. If you go and you seem like you're not prepared, no, they're not going to do it for you.
I love everything you said. Absolutely fantastic, excellent, on point. I'm going to read comments. So Oluwatosin Arodudu says, our minds operate at its sharpest during crisis if only we can stop throwing pity parties. Absolutely. And Shoboye just says, God bless you, Shimakiloto. Thank you so much. This has been great. Yes. Before you go to a mentor, have a plan. Before you go to a mentor, be prepared. Know exactly what you're looking for from the mentor. Mentorship is not for babysitting. It's only for guidance. And don't waste the time of your mentor. I love it. I love it. Thank you so much. Let's talk about leadership and governance for women. I'm going to talk about the election a little bit. It's just, talking about the recent US election. We now have a female vice president-elect. What do you think this means for the girl child out there? Do you think there's any significance? Is there something that we can learn from this?
Absolutely. One of the things that helps me professionally is, like I've said in the show previously, when I'm doing something, when I get involved in something, I always have this at the back of my mind. I know that there are people that are coming after me. And I'm always guided by, you don't want to leave a bad impression. One of the problems that we have in the workforce, and including medicine, is the lack of representation of women. There is still a lack of representation of women in fields of power. And so with the election of Vice President-elect Kamala Harris, this is like a new day for women and girls all around the world.
Absolutely.
People tend to identify with people, experiences, and others that look like them.
Yes.
If you see that someone is doing something, you can tell yourself, if this person can do it,
I can do it too.
I can do it. That's what I tell my kids all the time. For example, my kids, I show them, they know Barack Obama, even though they are still young. They know that Barack Obama was the first Black president. And I tell them, you see Barack Obama, he was the first Black president of the United States. You can become the president of the United States as well.
Absolutely.
And I tell them that, even though they are young, it makes sense to them. Why? Because they have seen someone that has walked in their shoes before. And so, Kamala Harris becoming the first vice president-elect is a big deal. It makes a difference for women and girls all around the world. Because now, every little girl can look at her and say, I can be like her one day.
Amen.
Do the things that she is doing. And so I think it's a game changer for women. And I'm hoping that more organizations will give women the opportunity to arise and actually lead. Because really, women are good leaders.
Yes, we are. We are good leaders.
Good leaders.
Yes. Thank you so much, Dr. Evi. I wish we could keep going on and on, but time is fast spent at the moment. So I'm going to give you 10 seconds. And my question is, what else would you like to say?
Thank you so very much for having me. It's been a pleasure being here today. So I would say this is a new year. This is 2021. I would tell people, do the right thing. And what's the right thing? Have a goal.
Have a goal.
Have a goal. It's not enough to have a goal. Have smart goals. Let your goals be measurable. Let them be goals that are achievable. Let them be goals that you can actually keep track of. You can actually see how far you have gone. Be accountable to yourself. And the last thing, be flexible. Flexible. You can set a goal and you can have plans for how you're going to achieve that goal, but be flexible because things can change.
Yes.
And be ready for change. When change happens, don't be tipped off and say, oh, this thing didn't work the way I thought it was going to work. Be flexible, be resilient and say, it didn't work out this way. Try another option. So those are my tips for the new year.
Wow. Have a goal, be flexible, try another option. Thank you so much, Dr. Evi, and thank you everyone for tuning in today. Until next time, I would say be exceptional, be intentional, and be on point. Bye-bye.